about that time when we get to close the conference. I know you all don't want to leave, but we do have to leave at some point in time. So I think it's saving the best for last. But before I introduce our next speaker who will close us out on the conference, I just had a couple of housekeeping things to provide to you. First, the videos for this conference will be available 1 week after today, and you will have access to it until May 12th. So if you would like to download any of the videos, please plan to do that during that time period. If you have any issues, just send us an email. We'll look up your registration details and be happy to assist. The second thing is, as part of continuous quality improvement, you will be receiving a survey after this conference. We ask that you please fill out the survey. The information you provide is really important. Sometimes we use it to guide the speakers that we'll bring next year. So please feel free to provide that input. As you would agree with me, it's been a wonderful 2 days, and it's because of the input we got from last year. The third and final logistics information I'd like to provide to you is that we will be in person next year, hopefully, fingers crossed. We really wanted to be in person this year, but Omicron happened, and we're hopeful that we will get a little bit more of a handle about this, and we will be in person. So save the date. It will be February 10th to 11th. I repeat, February 10th to 11th, and we will be in person so that we can all come and share our great ideas. And with that, it gives me great pleasure to introduce the Dean of the Arnold School of Public Health, Dr. Chandler. Dr. Chandler is in his 15th year of leading the Arnold School of Public Health. He has presided over an exceptional period of growth and development for the school at the university. Under his leadership, the Arnold School of Public Health has continued to set records in extramural funding, grown from 25.4 million in 2008 to 43.5 million in 2021. And our NIH funding has more than tripled during that time. This record funding is driven by a remarkable growth in faculty under the dean's leadership, nearly doubling the tenure track faculty ranks, now 93, and expanding overall faculty to 149 currently. Despite having to navigate the school through the unprecedented challenges of the Great Recession and a global pandemic, Dean Chandler has provided focused and steady leadership, enabling the school's success to continually accelerate. He's a champion of public health, research, practice, education, training, and yes, data, especially the effective use of big data to spotlight public health challenges and advance needed solutions. So it's my pleasure to introduce my boss and a wonderful mentor and friend, Dr. Dean Chandler.
Thank you, Banky. I'm hardly your boss, but thanks for those nice comments, and good afternoon, everyone. I guess I'm the last thing standing between you and Saturday afternoon drinks, so I'll try to be potent but brief. Back in about, I guess it was in 2019, the university dedicated around $11 million to launch, I think it was 8 high-impact projects for the campus. I was very excited at that time that we were selected to have 2 of these projects land in the Arnold School. And one of them, in fact, the most productive of them, has been the Big Data Health Science Center that you know by now is co-led by Xiaoming Li, Distinguished Professor of Health Promotion, Education, and Behavior, and by Banky Olutosi, a future Distinguished Professor of Health Services Policy and Management. And I'm very grateful for their leadership and assistance in making this initiative happen. We didn't have anything like this at the university before this center was erected. The Office of the Provost awarded this funding with the intent to help researchers really push the boundaries of scientific discovery. while also answering important questions that would help people live better lives, and especially better lives in South Carolina. Then less than 3 years later, the Big Data Health Science Center has surpassed every expectation for this initiative, with our center fast becoming what I think is a global leader in the health science big data space. Now, much of this success can be attributed to the center's ability to attract talent. And at present, they have 46 expert researchers along with around 60 students that are interacting from all levels and all programs across our university. They've also established an annual pilot project program that I really like, that has awarded more than $750,000 in funding over the past 2 years to about 20 projects that are involving 66, I believe, USC faculty members at this point. So clearly, the point I'm trying to make is that this center is having a very strong catalytic impact on big data science at our university. And we've got participants not just from public health, we have participants from nursing, medicine, engineering, computer science, statistics, geography, social work, and pharmacy. So it's been a wonderful initiative that I just felt the need to sing the praises of these two folks and the people that they pulled together. The center affiliated faculty have now submitted, up to this date, more than 50 grant applications, mostly federal with some state, and they've won, get this, it's just incredible, in less than 3 years, they've won more than $25 million in competitive funding into the college, into the university. Now, several of these projects, which are funded at present by the NIH, by the National Science Foundation, and also the CDC, are using big data to address COVID-19. And you heard some of those findings and talks over the past couple of days at this meeting. They're exploring topics like tracking viral spread using social media. They're looking at maternal and child health disparities, and they're developing data-driven strategies to fight the pandemic. In my mind, most importantly, the faculty and students in our Big Data Health Science Center have worked hard and have now published more than 100 scientific journal articles on their work to date. And they're publishing in very strong journals, ones with high impact factors, journals that get read by our community. They've also established a Big Data Health Science network of more than 750 members from academia, from industry, from federal and state government, and from our health systems all across South Carolina and even beyond. And this network in particular is thriving, and I'm sure if any of you would like to join it, all you need to do is email Banky or Xiaoming or Miranda, and they can link you up. They've got some really cool center-sponsored monthly seminars and also workshops that you'd find interesting. So give them a shout. So all these accomplishments have occurred in just the past 3 years, and that's pretty amazing given the time that science usually takes. But these are hard workers, and I'm extremely proud of them and feel very fortunate to have them as members of our college. But this conference is also just in its 3rd year, and every year the conference looks at ways we can unlock the power of big data in health. Last year, we focused on how to unlock the power of big data to bring innovation, to improve healthcare delivery, and to improve disease prevention. This resulted in a lot of plenaries, breakout sessions, workshops, poster presentations, and team competitions that you may recall were centered around electronic health records, geospatial data, social media, genomics, and even bio-nanomaterials. This year's theme examined how to unlock the power of big data for improved health equity through development of innovative interdisciplinary approaches. Now, I can tell you, health equity is near and dear to our hearts all across the Arnold School. We do some of the most impactful work in the country, and particularly in social determinants of health and in health disparities. I heard some of your talks at the virtual conference. I couldn't hear all of them, but I was very impressed, and it's simply amazing what's going on in this particular space. I just wanted to take a few moments to congratulate all of you and hope you'll keep this interdisciplinary momentum and attention to health equity and also health disparities moving and going forward for a long time. We really need it. So without further ado, just on behalf of the Arnold School, behalf of the University, the state of South Carolina, and of course the Big Data Health Science Center, I really just want to say thank you all for coming to this virtual meeting. And I can almost promise that next year it's not going to be virtual. We're going to get together face to face. And Xiaoming and Banky have already set aside some special money so we can have a grand post-pandemic party for everyone and maybe a pub crawl to go with it. So I hope you all have a great rest of your weekend. And I hope to see you next year, February 10th and 11th, 2023. Take care.